Nursing informatics refers to the practice and science of integrating nursing information and knowledge with technology to manage and integrate health information. The goal of nursing informatics is to improve the health of people and communities while reducing costs. Nursing informatics incorporates the fields of nursing, computer science, and information science in order to manage medical data and develop and maintain data systems that are designed to improve patient outcomes as well as boost the overall performance of a healthcare organization. They use computer science, patient care, healthcare management, and information science knowledge to make the data flow in a more streamlined fashion, improve health outcomes, and help doctors and other clinical staffs relate better to their patients and vice versa. Sphygmomanometer is an instrument for measuring blood pressure. It consists of an inflatable rubber cuff which is wrapped around the upper arm and is connected to an apparatus that records pressure. An arterial blood pressure reading consists of two numbers which typically may be recorded as X and Y. The X is the systolic pressure and the Y is the diastolic pressure. Systole refers to the contraction of the ventricles of the heart. When blood is forced from the heart into pulmonary and systemic atrial circulation, and diastole refers to the resting period when the ventricle expands and receives another supply of blood from the atria. At each heartbeat, blood pressure is raised to the systolic level, and between beats, it drops to the diastolic level. As the cuff is inflated with air, a stethoscope is placed against the skin at the crook of the arm. As the air is released, the first sound heard marks the systolic pressure. As the release continues, a dribbling noise is heard. This marks the diastolic pressure, which is dependent on the elasticity of the arteries. And that is sphygmomanometer.
Oxygen cylinders, or also known as oxygen tank, is a metal container filled with oxygen under high pressure. It is a medical device means to provide supplemental oxygen to the patients. It helps people who are facing respiratory issues or those who have low blood oxygen levels. An oxygen tank stores oxygen in which then dispensed to the patient using an oxygen mask, nasal tubes, or an oxygen rebreather. Oxygen tanks are widely used in the hospitals and outpatient clinics.
Hospital Smart Bed. The function of the hospital smart bed is to facilitate the patient's movement and help him regain his normal movement faster, with the presence of monitoring system that alert the nursing staff when the patient moves and leaves the bed with the availability of side rails.
Suction pumps are used during and after the surgery to remove the surgical fluids, tissue including bones, gases, and body fluids. So, suction may be used to clear the airway of the blood, saliva, vomit, or other secretions so that the patient may breathe. And suctioning can prevent pulmonary aspiration, which can lead to a lung infection.
The weighing scale has two major variants, the mechanical and the digital weighing scales. Weighing equipment can be used to monitor progress, to read the patient weight, to prepare and provide the correct medication. For all, it is important that the information is reliable and accurate. High quality and specialized weighing instruments are key in this aspect.
The anesthesia gas machine is also called the anesthesia workstation or anesthesia delivery system. The gas mixture can be delivered to a breathing system. Anesthesia machines are one of the most versatile medical instruments in the healthcare industry. This device helps doctors sedate their patients before surgery and keep them asleep while breathing throughout the procedure.
A cardiac monitor is a device that you control to record the electrical activity of your heart. So, this device is a way of watching the electrical activity of your heart to ensure it is working normally. And this device can also help your doctor to understand your overall heart health by measuring certain aspects of your heart function.
Next, we have the radiant warmer. So, what is radiant warmer? Radiant warmer provides heat using an overhead heating source. So one of the nursing care for baby under infant radiant warmer is to keep the baby's body temperature stable and slows down their metabolism.
Cardiotocography is usually called a CTG. It is a graphic recording of fetal heart rate and uterine contractions during pregnancy by the use of electronic devices indicated for the assessment of fetal condition. CTG is used both before birth and during labor, and its purpose is to monitor the fetal well-being and allow early detection of fetal distress.
Good day, this is Norman Cota and I'm from City University of Pasay, and I'm currently third year and coming fourth year with a degree of Bachelor of Science in Nursing. So my task today is to explain and differentiate the advantage and disadvantage of nursing informatics. So we will start actually in what? In advantage. The nursing informatics here in the Philippines has so many advantages when it comes because of the technology's advancement. So first is enhanced efficiency. What do you mean by that? So nursing informatics enables the automations of various nursing process such as patients documentation, monitoring, scheduling, inventory, and management. So these automations reduce paperwork, not only the paperwork but also saves time for us nurses and allow nurses to focus more on the patients. Second is actually improve the patient's care. With nursing informatics, healthcare like nurses, healthcare providers can access accurate and up-to-date patient information. Not only does those nurses but also those other healthcare can actually make a collaborations. And it includes medical history of the patient, the diagnosis of the patient, and up-to-date patient information and treatment plans. So this access to comprehensive data help nurses make informed decision and promote patient safety and deliver higher quality care. Next is data-driven decision making. On this process, it enables the collection of analysis and interpretation of the nursing data, including the large amount of healthcare data. So meaning, you can actually the nursing informatics IT or technologies can hold not only one patient information but also other patients' health informations regarding on that institute who actually use nursing informatics, such as apps and developments. Fourth is collaborations and communication. With the help of nursing informatics, you can actually collaborate, especially on those other healthcare providers, specifically on physician. So if you have app or digital charting, all you're gonna do is that you can transfer it on the physician, and the physician can actually read it within the seconds. Not unlike the paperwork, there's a tendency that the paperwork can actually miss, or the paperwork can actually prolong to check by the physician. And lastly, the advantage of nursing informatics is to enhance patient engagement. With this, it actually empowers patient by providing access to their own health information. Not unlike charting, patient can actually not see the prognosis and the treatment plan she have or he have. Not unlike having nursing informatics, the patient has actually access to see, and she or he actually can participate in self-care and promotes health literacy and foster a partnership between the patients and also us, the healthcare providers. So what are those disadvantages of nursing informatics? Okay, first, infrastructure and resource limitations. We all know that the Philippines is a third world country, so that it actually not focused on the healthcare. So Philippines has no budget when it comes to technology, specifically in health. So there's resource limitations So other public hospitals, specifically other public hospitals, has no nursing informatics and actually continuing charting with the use of paper. Some hospitals, such as private, they have access on nursing informatics because they have budget to do it. Second, it actually cost and training, initial cost and training. Some nurses in the Philippines are traditional. Mostly those nurses from 90s and up till now, they are they are good in charting in paper but not good in using technologies. So it actually costs time to train them, and the training them is actually have fee, and implementing nurse informatics to them, such as software purchases, system integration, and staff training. All of this thing will cost and many costs. So third is data privacy and security risk. There's a tendency that someone can breach the data of the patient or the system vulnerabilities. And protecting patient data and ensuring its confidentiality, integrity, and availability require robot security, but we cannot trust robot security measures, no? And last and fourth is limited digital infrastructure. We all know that Philippines is not yet high-tech in terms of information technology. That's why some hospital in the Philippines is still doing charting with the traditional papers, not using nursing informatics or computer software updates. 5 is resistant to change. Some Filipino nurses are resist on changing, and some patients too, because it is a common challenge when implementing a new technologies, including nursing informatics. Some nurses and healthcare professionals, also the patients, may be hesitant to embrace new system because they think it's hard, or they fear that it is overcoming resistance to change and ensuring proper change and management. So strategies in place is a crucial that successful implementations and acceptance of nursing informatics and initiatives. And that is all the disadvantages and advantages of nursing informatics.